Well, Public Health Wales has got 7 strategic priority areas, and one of those focuses on mental wellbeing and resilience. So within that wider priority, we'll be looking at having a national conversation on what does it mean to the people of Wales to be mentally well. So we'll be looking at what factors influence individual and community resilience. We're also going to be looking at how we should be collecting statistics on the well-being of the population regarding their mental health, and we'll be looking at rolling out some of the whole school approaches in conjunction with education partners and others to do with healthy schools, a whole school approach to mental health and Healthy Working Wales. And then lastly, we'll also be looking at trying to create a trauma-informed and ACE-informed society, both at the professional level and at the family, community and individual level. I think it would be great if we could have earlier intervention and early access. If we can inform society so that they're actually psychologically literate and they have early recognition, it would be great that the care is much wider than the present medical system, if you like. So I would really like to see a more preventative approach, but also for the times when we are unwell with our mental health, then it would be good to know that that care is very much led and co-produced with patients, that the patient voice is there, and that it's trauma-informed care that doesn't re-traumatise by denying people of basic human rights in the name of their mental health. It's vitally important, and I think that mental health and well-being is really contingent on so many other aspects of our lives. So we know that policies about education, employment, housing, access to health services are all vitally important, and that wider determinants landscape, if you like, is one in which we all have our mental well-being. I was really struck by hearing a member of the deaf community talk about the difficulties that people with deafness have in accessing services, and for a group that's already isolated, it's really important that we think about how equality of access really works in practice. But it made me think that there are many other groups of people that need to have that enhanced access to services. So people who've been traumatised, refugees, asylum seekers, people who speak other languages, and people who can't access perhaps normal resources because of sensory or physical disabilities.